abortion. And this allows us to use all available data on all related pregnancy outcomes in our statistical model. So we can make use of so much more data than if we were just estimating abortion alone. Instead, we're concurrently estimating all pregnancy outcomes using the predictors of intended and unintended pregnancy, and then births, intended, unintended abortion. We express concepts like uncertainty in the raw data, the direction of bias in those data in our model. We're obviously not going to discuss that in a 5-minute presentation. And I apologize if even this prelude was vague and not really delving into it in a way that really gets at the flesh of the matter. But I do want to mention that these are model-based estimates. Just like the UN family planning indicators or WHO maternal mortality, these have uncertainty. And we do have online resources where you can look at the estimates and even make statistical comparisons and do things like say, what is the probability that this trend happened or this country is higher than another? Last prelude point, we produced estimates for 5-year time periods from 1990 to 2019. But this means that the estimates are for 5-year periods like 1990 to 94, 2015 to 2019. And we're going to focus on the most recent time period today. I want to be really clear that these are annual average rates. So like when I say 2015 to 2019, I'm not saying the total across 5 years. I mean each year on average in those 5 years. So to set the stage, let's do a little global averaging. Each year on average in 2015 to 2019, about 250 million pregnancies occurred worldwide. Of those 250 million pregnancies, about half, so 48%, 121 million were unintended pregnancies. 61 million of those ended in abortion each year. And when I say abortion, I mean induced abortion. So those 61 million abortions each year correspond to 29%, so almost 1/3 of all pregnancies, or 61% of all unintended pregnancies, 6 in 10. The global average rates per 1,000 women who were 15 to 49 per year were 64 for unintended pregnancies and 39 for abortion. That sets the stage. I'm not going to talk about unintended pregnancy anymore for time, but it's important to contextualize that the vast majority of abortions follow from unintended pregnancies. Here's a map. It shows the distribution of abortion rates across countries. Standard preludes, we produced estimates for 195 countries and territories, all of which inform our global averages, our regional averages, et cetera. But not all of them have data. And based on certain rules, we've only publicly released estimates for 150 of these countries and territories. That's why you're seeing gray areas. Unsurprisingly, we don't have abortion data in Antarctica, but also the Middle East and North Africa, you can see. And that's because that's a region where there's no reliable abortion data whatsoever. The borders don't represent official position of the WHO, Guttmacher, et cetera. They are whatever I happen to get working and draw.
Jonathan, we can't see the map. Can you go forward one slide?
It's on my screen.
Oh, now it's shown up for us.
Okay, thank you for alerting me to that, Anna. So in the region of Europe and Northern America, you can see a relatively uniform blue color. It's signaling less variation between the countries than some other regions. And in those, if you look at some other regions, you can see rates vary tremendously. There's even more variation among countries within a region than we see between regions. So for example, globally, we have a low of 5 in Singapore for the abortion rate per 1,000 women of reproductive age. Also in Switzerland, where the rate was also 5. So those were our lows, Singapore and Switzerland. But the abortion rate ranged up to 80 per 1,000 women of reproductive age in the country of Georgia. Europe, rates were as great as 46 in Russia. In Africa, rates range from 15 in Niger to 60 in Madagascar. In Latin America and the Caribbean, abortion rates range from 11 in Uruguay to 55 in Cuba. In Eastern and Southeastern Asia, they were as high as 64 in Vietnam and as low, as I mentioned earlier, as 5 in Singapore. In Central and Southern Asia, abortion rates range from 19 in Turkmenistan to 48 in India. And of course, we're not drilling down below the country level, but there would be similar differences if we were able to explore these data subnationally as well. So I hope you can all see the next slide. I have switched to it. So I want to show you an average. So here we're grouping countries into 3 categories. In blue, those are reflecting places where abortion is broadly legal, like where it's available on request or for a broad range of social and economic reasons. On the right side, you can see countries where it's prohibited. And in the middle, there's this in-between category where there are some grounds of abortion. What this graph tells you is that abortion rates are similar across these 3 categories. Thus, irrespective of the legal setting, we do not see any pattern in relationship to the law. But we have to be careful because we need to be clear what we mean when we're talking about this. So understand that most abortions come from unintended pregnancies. Countries that restrict abortion are usually lower resourced settings. There's more unintended pregnancies in general in those countries. I am not saying that a person who has an unintended pregnancy is just as likely to want and be able to obtain and successfully obtain an abortion in those settings. I am saying that when you combine the greater unintended pregnancy rates with the lower proportion of those ending in abortion, the abortion rates are similar. Now, here's just one region, Latin America and the Caribbean, and I want to illustrate something. Look at the spectrum across countries here. I'm using the same colors. Uruguay on the far left, Cuba on the far right. They're in blue. Abortion is broadly legal. Those are the smallest and the greatest abortion rates. As you can see, the distribution of countries by legal status are distributed throughout this range. So legal status is not determinative of abortion for the host of reasons I mentioned, including we're looking at the most recent time period. So on average across the whole world, even in countries where it's restricted, around half of unintended pregnancies end in abortion. A lot of this that's much more than years ago and years ago. What's going on is a lot of factors, including the widespread availability of misoprostol. But looking at the current picture, legal status for all these reasons, access to medication abortion, the strong desire to terminate an unintended pregnancy, despite barriers, women are often successful and able to obtain an abortion, which doesn't, of course, mean we need to do more in terms of making it legal, making the quality of care better. We really like to collaborate. We first released this paper, I think in the middle of or late March, and then a week later, the UN FPA released their flagship State of World Population Report. You can see here the cover page. It was about unintended pregnancy. And because we were able to give them preliminary data in advance, our preliminary work, they were actually able to cite our work throughout to motivate their work, but also do additional analyses beyond which we ourselves had the time and capacity to do. So for example, the UNFPA used their estimates to focus on gender inequality and using stories to show, what these numbers really mean to individual stories. And you can see here a graph showing that unintended pregnancy rates are highly correlated with gender inequality, for example. So what does this somewhat mixed picture actually tell us, and what are our take-home messages? Abortion is a normal experience We spoke of more than 73 million abortions each year. It happens across countries and across high income and low income settings, across countries grouped by the legal status of abortion. I mentioned, of course, that rates are similar in countries that do and don't prohibit abortion, but of course, safety estimates, which we don't talk about here today, there's very large differences in the safety and quality of abortion care by the legal status of abortion. There's wide variation in rates between countries and between regions, so it really pinpoints the need for investing in country-specific data, country-specific estimates, and analyzing the country context. I explained how unintended pregnancy is a driver of abortion rates, but abortion rates are also influenced by the percentage of unintended pregnancies that end in abortion, and those can vary due to numerous factors. Overall, what the data tell us is that we need comprehensive services in all contexts, comprehensive sex ed, family planning, as well as access to safe, quality abortion. Heather?
Thanks, Jonathan. You know, every time I hear you walk through these data, you know, I pick up on new things. So thank you very much for that presentation. As you can imagine, we and working with partners and in collaboration are thinking about how to leverage this data and what directions that we can take this in order to press for change and improving the situation. You know, certainly these disparities between the countries and within the regions really demonstrate the critical need for targeted investments. We've zeroed in on, you know, national governments in particular and how they themselves can prioritize domestic funding in order to ensure that there is access to quality and affordable sexual and reproductive health services in their country, and even providing specific budget allocations so that this can be tracked over time. And of course, donors and multilateral agencies also play their own role in terms of you know, strengthening investments and providing that kind of guidance and support to others, and improving flexibility in funding and encouraging countries to do so in order to respond to changes in the moment as the landscape changes. Next slide, please. And finally, we're also looking at, you know, the whole debate around universal access and the ways that this evidence can be leveraged in those spaces. And again, we focus on national governments and multilateral agencies. For national governments, you know, we're thinking a lot about what are the plans and strategies that they're setting out for achieving universal health coverage. What are the ways that quality services can be a focus, and how does this inform that? And also, what is the opportunity here in the moment for implementing and adopting the WHO standards for abortion care, which, as you know, were science-based and really pushed you know, a lot of this in the right direction in terms of self-managed care and minors' rights and the like. For multilateral agencies, of course, they're looking at the whole picture, and the inclusion of this essential package of sexual and reproductive health interventions as part of UHC efforts is really key. They also, along with the governments, have a way of, or can play a key role in tracking progress and strengthening accountability, and can play a role also in the adoption of the Guttmacher Lancet comprehensive definition for sexual and reproductive health and rights, which really set out this definition that distinguishes sexual health and sexual rights, reproductive health and reproductive rights, and looking at that holistically and comprehensively, and the kind of interventions that are needed. And then finally, of course, CSOs and provider associations have their way of influencing governments and multilateral agencies, and can work on leveraging these data in their own agenda setting, informing key global policy discussions, and really distilling this information for key audiences in order to push for change. So that's kind of an overview of how we're thinking about leveraging the data and the role of kind of these different stakeholders in the midst of this. On the next slide, we simply want to invite conversation now. We only have a few minutes left, but hopefully we can use our time to answer any questions that you may have, or even brainstorm other ways that this information can be used in different circles.